Hi, this video is to demonstrate a PICC line dressing change. Here we have our PICC line, and see that? We're going to change the dressing. The dressing is changed 24 hours after initial insertion of the PICC line and weekly thereafter. To save time for video purposes, I have already done hand hygiene, put on my gloves, set up my sterile tray. To my tray, I have added alcohol swabs, 4 of those. I have added StatLock package, okay, and the contents that are in the white strip, the StatLock itself, and the skin prep. I have added a large Tegaderm, and I have added 3 chlorhexidine sticks. Okay. So the first thing I'm going to do after explaining and positioning my patient is I'm going to measure with a measuring tape the insertion site, which is right here, okay, to the hub, which is where the white part of the PICC line meets the blue part of the PICC line. And you can see that often the PICC lines will have hash marks, which are centimeter marks, but I will go ahead and measure. So when I measure, I am going to get about 2 centimeters, and I will remember that as my pre-measurement because I will be measuring again after my dressing change to make sure that the PICC line hasn't migrated during the dressing change. And anything 5 centimeters or below is acceptable. Anything greater than 5 centimeters is really reportable to your charge nurse. Okay, so the first thing I need to do is go ahead and put on a mask because I am going to want to cover up my mouth and nose because I am opening up the Tegaderm. Everything under the Tegaderm is sterile. Okay, so if the patient is got a lung infection or is coughing, you're going to have them wear a mask as well, and if not, they could simply look away in the other direction of where you're doing the dressing change. First thing I'm going to want to do is remove the Tegaderm, and it's very sticky because it's been on for a week. So I'm going to stretch it from the edges, and that will help to disengage. I don't want to touch anything under the Tegaderm because it is sterile, and I'm not wearing my sterile gloves yet. I'm going to pull my Tegaderm up, being very careful of the insertion site so I don't pull the PICC line out. And once I do have the Tegaderm loosened, I'm going to remove it in the direction of the insertion site. Okay, and then I'm going to take that off, throw that in the garbage, and I'm also going to put my gloves in the garbage. Now I'm ready to put on my sterile gloves, and I put on my sterile gloves. Once I put on my sterile gloves, I will be able to touch everything that was under the Tegaderm as well as everything that's on my tray. Non-dominant hand first. And then my dominant hand. I'm going to fix my fingers and get all the air and wrinkles out as best as I can. And then I can touch my tray and my PICC line insertion site. So I've got my sterile gloves on. The next thing that I need to do is I need to clean the insertion site. So I have 3 areas to clean. I have the insertion site, I have the arm, and I have the PICC line itself. So I want to first start by taking one of my sticks. I have 3 places to clean, 3 sticks, and I want to clean the insertion site. So I'm going to move this out of the way. I'm going to clean the insertion site by doing a circular motion. Okay, and then flip my stick and go underneath. And your arm won't roll away, hopefully. And I'm going to clean under there as well. Okay. Then throw that stick away, and you're going to allow that to dry. The next step is to take the white strip that was in your StatLock package, and you're going to put it onto the PICC line, not covering the insertion site, so about halfway between the insertion site and to where you measured to. And so that is to keep the PICC line from getting pulled out during the dressing change. So you do want to have the PICC line always either in the stat lock or being secured with the strip. So I'm going to put the strip on, and I'm going to stretch it and pull it right across here, like so. Okay. Now that will secure my PICC line. Next thing I'm going to do is I'm going to take the PICC line out of the stat lock. I want to put a drape in place first so I can have a clean work area. And I want to pick up the tails of the stat lock, but I can't do that without using something because they're dirty and my hands are sterile. So I'm going to use one of my 4x4s for my tray and simply lift up the tails, and I'm going to put my drape across. Just a place for them to sit. Okay. Next, I want to open the doors of my stat lock, and I can touch that because it is sterile. Okay, and you're going to get your fingernail underneath there and open the door. Okay, and once you open both doors, then you're able to move your PICC line. Again, you want to take a new 4x4 and just simply move your PICC line right out of your way. And now you want to get the stat lock off of the patient, and if you forget, you can use alcohol, and it does say, if you forget, it says remove with alcohol. So the alcohol disengages the glue. You're going to rub it on the wings, like so. Okay. And you've got 4 swabs, so you've got lots of swabs here. You want to soak both wings. Sorry, my arm is rolling away. Oops, that's gone. Now you want to start pulling the stat lock away from the patient's arm, and as you are going underneath, I'll try to make it so you can see, I am lifting the stat lock and I'm using the alcohol underneath to disengage the glue. Okay, and as you pull away, be very careful not to contaminate. And now you want to try to get as much of that glue off that you can. Okay, good. Next, we are going to clean the arm. Okay, so we've cleaned the insertion site. Now we're going to clean the arm, and we want to clean the PICC line itself. So we're going to again take a new 4x4, wrap it around your tails, lift up, and I'll try to do it so you can see, and you want to clean the arm in a checkerboard pattern. So lots of friction, go back and forth, then flip your stick and go the other direction. Okay, and then throw your stick out, maintaining your PICC line up in the air so you don't contaminate. You now want to clean your PICC line itself. So you just want to expose the area that was sterile. See if I can show you here so you can see better. And you want to take a new swab and go on the underside of your PICC line, and then flip your stick and go on the top of your PICC line. And normally your PICC line will have a writing on it, and the writing is on the top. Okay? So we have now cleaned the arm as well as the PICC line itself. So you're going to give that 15 seconds to dry. And next we're going to put on the skin prep so that when the person changes this PICC line dressing next week, they don't take the patient's skin off with them. So you're going to take your skin prep that was in your stat lock package, and you're going to open that up. And again, you want to lift your PICC line. And you want to be very generous with your skin prep. You want to apply it where your stat lock is going to sit. Okay. Next, you're going to let that dry. While that's drying, I'll show you, this is the stat lock itself. You can see it has 2 little doors. I often will kind of move the doors around a bit to loosen them up before I put them onto the patient. Also, it has arrows, and the arrows point towards the patient's head. So you want to put it in this direction so that the arrows are pointing up towards the patient's head, not down towards the patient's hand. And the PICC line has 2 holes on either side of the blue triangle, and you have 2 pegs here on either side of the stat lock. So what we're going to do is we're going to match up the holes in the pegs, and then we're going to close the doors. Now we don't want to put the stat lock onto the patient and then close the doors onto their arm, because that's fairly uncomfortable. So we want to actually put the stat lock into, the PICC line into the stat lock first, close it in our hands, and then stick it to the patient's arm. Okay? So first thing we're going to do is we're going to pick up our stat lock, make sure that the writing is on the side that will be up in the air. So the side that you will be able to see when you're finished, so the writing doesn't face the patient's arm. Okay? And we can touch that because it is sterile. We want to make sure that the arrows point towards the patient's head, and you want to simply match up your pegs and your hooks. So I think I have to stand up for this so I can see. Okay, there we go. And you want to match them both up and close the doors. Okay, so we're going to match them up, and we're going to close the doors on our own hands. Okay. All right. Then the next thing you're going to do is you're going to hold with one finger, and you're going to take away the tape on the other side. So you're going to hold it down, and I might have to get it started here first. It's giving me a little trouble. My arm is rolling away. There we go. So as you pull away, you're going to smooth it. And again, you want to make sure that the arrows are pointing towards the patient's head, and they are. And then you're going to do the opposite wing. Okay, take the paper off and smooth it out. Okay, you do your best. Whoops, you do your best to smooth out all the air and wrinkles as best as you can, so that it helps to secure it as well. Okay, now that we have put the PICC line back into the stat lock, or we've re-engaged the PICC line and the stat lock together, we need to take off the white strip. The white strip can't stay on. The glue is not good for the PICC line. It certainly could eat a hole into the PICC line in a week's time. So we do need to get that off. So very carefully, we're going to take that off. And again, it's like a tegaderm in the fact that when you stretch it, it does come off a little easier. It doesn't come off. There we go. I was going to say, if it doesn't come off in one piece, you'll do your best to get all of that leftover white strip off of the patient. Okay? So next, all we need to do is put on our tegaderm from our tray. So we get our tegaderm, and we want to make sure that we use a bigger tegaderm. My tegaderm's stuck here. Here we go. So we use a bigger tegaderm. Okay, and you want to make sure when you apply your tegaderm, two things: that you stretch it, that helps to make it sticky, and as well you want to cover the insertion site as well as the stat lock itself. Okay, so we're going to stretch it and we're going to apply it. Do your best to have as less wrinkles as you can. Now that the sterile part is covered, I'm not concerned about my sterile gloves touching everything now. I certainly can touch what I need to touch now in order to get this tegaderm as smooth as I can. You won't get it 100% flat to the patient, but you'll do your best. You want to keep as well the little label that came on your paper of your tegaderm. Okay. And then we're going to take our time and smooth that down, get all the wrinkles out best we can. Okay, and the last thing you would do is you would write your date, time, and initials on the label that was on the tegaderm, and you would put it on. You don't want to put it over the insertion site or on the patient's bare skin, so I normally just put it along one of the arrows. And then the last thing to do is to measure again. So we would want to take our measuring tape, okay, and we would want to measure again from the insertion site to the hub, and again we have 2 centimeters. So we did not migrate or pull out the PICC line during the procedure. And that would be it. You can do your hand hygiene and take off your mask. And that is a PICC line dressing change. If you have any questions, please contact me.